It's 6:20. We have an orthodontist appointment.
Uh-oh. Get rid of that candy. Hi, Steve.
Hi, Steve.
Yeah, get rid of that candy because that is a no-no for sure. Actually, we're going to talk about how we'll, here at the Red Hill Orthodontics, they will buy your Halloween candy, but that's coming later on in the show. But orthodontics, that is a relatively new term in the English language. It certainly wasn't there when I was a youngster, and for a lot of you, you wonder, what is this anyway? But we're at the Red Hill Orthodontics today, and Dr. Susan Eslambolci is here to, one of the partners of this firm business, that will just tell us a little bit about, first of all, what is it? And certainly every parent has touched this at one time or another. Sure. Tell us a little bit about what you do.
First of all, good morning to all our viewers. And the orthodontics is a branch of dentistry that specializes in the diagnosis, the prevention, and the treatment of facial and dental irregularities. So in simple terms, a malocclusion just means a bad bite. And what orthodontists do is they correct crooked teeth as well as any facial deformities.
Now, we do have some history here, a little bit of history, because this is a fast, not a new part of dentistry, but certainly is fast evolving.
Actually, orthodontics goes back to even as far back as 1000 BC. So there's been some evidence to show that as far back as 1000 BC, people have been trying to correct teeth. But modern orthodontics is probably about 100 years old. It's just over 100 years old. And it was actually Dr. Angle. He's considered the father of modern orthodontics. He's an American orthodontist. So a lot has changed in the last 100 years. We can... if I can show you this picture here, this is actually how braces looked from about the 1970s onward. Before that, the braces were actually covering the entire tooth. So the metal would go entirely around the tooth. And since the 1970s, we've been able to actually glue the braces directly onto the teeth. And since then, of course, the braces have been getting smaller and smaller and more aesthetic.
And invisible almost.
And almost invisible. And you can see these are the braces that we currently use in this office for patients that would like clear braces. And you can barely see them. So they've really come a long way.
So that's a good start. We're going to come back a little bit later on. We're going to talk about who should use them, kids, but not only just kids, adults as well. So we'll see you in a little while. Thanks for being here today. We're going to take a short break. More on Morning Live when we come back.
Leave your old jalopy by the railroad track.
6:49 now. We're heading back to the orthodontist with Steve Reddick.
Hey, Steve.
Open wide.
How you doing, everybody? And yes, we're back here at the Red Hill Orthodontics, open a little bit earlier than normal for today. Just to reintroduce our characters here, our cast, we have two doctors who are partners here. Dr. Susan, who we've already met, Eslambolci, and she's going to do a little examination on me, although I'm not a kid, and we sort of, orthodontics and kids sort of go together. Dr. Rahimi is partner here, and as well, thanks for getting up so early to be with us.
Good morning.
And well, Dr. Susan is sort of having a look at my mouth here. Could you give me an idea what the difference is? Because it looks like a dental office, but it's certainly a different kind of dental work.
Yeah, absolutely. So basically all orthodontists are dentists, but typically we go through 2, sometimes 3 years of extra schooling to become an orthodontist, where you learn about sort of the growth and development of patients and in general about how teeth fit. So when we do an exam, and obviously it's good to note that age is pretty much irrelevant as far as treating orthodontic patients, but we look for, other than the fact that the teeth are straight, they're crooked, are they spaced, and basically how they all fit with one another. So other than the perceived notion of all the teeth being aligned properly, the important thing from an orthodontist point of view is that they also meet together properly, which is the important part of it. So Susan's looking right now at the alignment of the teeth, and then usually we'll have a patient close their teeth together exactly and sort of see how they fit. I don't know if I should comment about Steve's bite.
I'll tell you the story about my bite one day. Anyway, we're going to come back a little bit later on because I know that you don't have to be a teenager to have orthodontic work done. So we're going to come back and we're going to talk a bit about some of the things that these folks here can do to change things, not just to make you get an extra smile, but also to help things facially for you as well and help some serious problems out there. So all that coming up in our next half hour.
I knew I'd made a horrible call, and now the state.
With another visit to the orthodontist.
Open wide.
You've already seen my mouth.
Yeah,
so I don't
actually, we've
think you
seen
need to
enough
see-
there, yeah.
You've seen enough of that. I think we'll move on
People
to
are
some other
eating.
things. Now, guys, most people will come to the Red Hill Orthodontics Clinic to see Dr. Rahimi, and they may have some abstract thought of, I want a nicer smile, or, can you straighten this tooth? They're not quite sure what's going to happen. But once they get here, Doctor,
Sure.
there's usually a myriad of other situations going on. So, we've got the neat graphics here. Can you just give us an idea of a couple?
Yeah, so I mean, obviously the common reason patients come here is the crowding. So this is just showing a brief, synopsis of what happens in a crowded patient and how we, how we straighten their teeth. But really, there's a number of other problems. A common one is something called a crossbite. That's where you have teeth on top that are inside the bottom ones. And so what we do for these patients is we widen their upper jaw typically to make the teeth fit properly together. So that's really our goal, is not only to make sure that patients have straight teeth, but also that their bite functions properly together. So that's definitely one one example. Another.
I gotta get you to go back to the other one we showed just
Absolutely.
on our little
Absolutely, we'll do that.
promo just a little while ago of moving
Yeah.
that tooth, and that is an amazing thing where the teeth actually can be moved, not just a little bit, but a whole lot.
Yeah, so I mean, teeth move through bone, and that's the basic premise of orthodontics, is that by applying a force to a tooth, you can move it through bone and position it where you want. This is a fairly common problem where
That's amazing.
where patients come in and they have a tooth that didn't grow in the right spot and typically is in the roof of the mouth. So we need help on this one from our other dental specialists. So we would typically send this patient to either a periodontist, which is a gum specialist, or a oral surgeon who specializes in surgery. They will what's called expose the tooth for us, which means they clear away the gum tissue and the bone tissue on the tooth so we can access the tooth. We can then place a chain on that tooth and then
Move it in.
apply a force, which is the basic premise of orthodontics, is applying a force to a tooth in order to move it to a desired location.
Okay, thank you very much. We're going to take a short break. We're going to come back a little bit later on. A lot of you take your kids to the orthodontist, and we've got the exam coming up. We'll show you what happens in the exam with a little 8-year-old young lady. All this coming up a little bit later on.